All right, good morning, everybody, and thank you so much for everyone's patience and flexibility this morning, and hopefully we'll all stay dry. I'd like to invite Laura Dragowski from the Mayor's Office, the Critical Communities Manager, to come on up and kick us off. Pardon me, hi. Welcome. Thank you all for joining us today as we announce the Health, Safety, and Justice Initiative in the City of Pittsburgh. The Health, Safety, and Justice Initiative will include the Offices of Community Health and Safety and the Office of Community Services and Violence Prevention. Today we especially want to thank Mayor Peduto, Councilmember Lavelle, Councilmember Reverend Burgess, Councilmember Bobby Wilson, and Councilmember Erica Strasburger, as well as Assistant Director of Public Safety Chatara Murphy, who will be speaking with us today, Director of Public Safety Wendell Hisrick, Chief of Police Scott Schubert, and Dan Palka, who's the Director of the new program that will be partnering with AHN to achieve this work. So in July, we announced the Office of Community Health and Safety as an opportunity to learn more from our community, to learn more from our first responders, and to build out responses and resilience in the community that would mitigate harms that people are experiencing in encounters with public safety. This is largely because public safety has become our safety nets for so many of the situations our community members are encountering. And we recognize that the importance of this is to find the right responder who meets our community needs. That is police, that is EMS, that is fire. They have critical roles and they do excellent work, but that's also social workers, that's also public health professionals, that's also family support specialists. And what we really intend to do here is to better understand the needs of our community and to better understand It's 2020, and to better understand the needs of our public safety professionals so that we can meet those needs. What is especially critical is that we get this right. That means that this work is not going to happen in a week or in a month, but we're very committed to this work. We recognize that this is going to involve conversations, trust building, relationships, and really hearing from people the hard stuff that candidly is difficult to hear. But we know that to get this right, it will mean sending the right responder, and that's going to require exceptional input and commitment from our community. We also will be partnering with a program that is launched at Allegheny Health Network and led by Dan Palka, who is the administrative director. In that program, we will see a partnership with first responders and the community to better understand what needs they're experiencing, whether it's an individual who's experiencing homelessness, substance use, untreated mental health issues, anything across a continuum that is forming trauma and may result in difficult relationships with first responders. So it's my privilege to introduce Dan Palka to speak more about that program. Thank you.
Thank you, Laura, and thank you, Mayor Peduto, for having me here today. On behalf of Allegheny Health Network and the Center for Inclusion Health, we are extremely proud to be partnering with the City of Pittsburgh on this really important initiative. The Center for Inclusion Health was founded in 2014 as one of the nation's first integrated comprehensive care programs that's focused on access and health care for the most marginalized and underserved populations. We work with people in addiction, food insecurity, HIV/AIDS, immigrant and refugee health, transgender health, and homeless street medicine. CIH seeks to address the critical health disparities that are the result of racial inequity and social determinants of health. This work is more important now than ever, which is why we're so excited to partner with the City of Pittsburgh and their new Office of Community Health and Safety. In this new program, we will be building neighborhood-based teams that will partner with human services, law enforcement, EMS, and local partners to try to promote positive relationships with people who are experiencing homelessness, to connect them to resources, housing services, and health supports, collaborate with first responders to prevent recurrent interactions, and to promote health outcomes, recognizing that addressing health is a critical part of stable housing in this community. The person-first, strengths-based model that the CIH employs is in alignment with the priorities of this new office, which recognizes that the unique neighborhoods in the city of Pittsburgh have their own unique strengths and characteristics. As such, each of the teams that are working in these neighborhoods will try to reflect the unique values and needs of these respective communities. Our objective is to recognize the needs that already exist in these communities and help to support them and build connections between them amongst our other community partners. We look forward to sitting down with the communities and understanding the barriers that they face when trying to provide support for their homeless neighbors. There's a rich history in this city, in this work, and this partnership is a critical step forward in trying to ensure that it has a future as well. Next, I'd like to introduce Councilman Bobby Wilson, who has, since its inception, supported this program and the work of the Center for Inclusion Health in the North Side. Thank you.
Thank you, Dan, and I want to thank everyone here today, especially other council members, especially Councilman Reverend Ricky Burgess and Daniel Lavelle. So also the mayor. So we had to change it up today. We had to come. The weather's not our friend today, so we had to change it up a little bit. I want to talk about the space we were going to be in. We were originally planned to be in the East Commons, and the East Commons is known for one day being a farmer's market, the next day being a place where people can enjoy Zumba. But every day, there are people that are in transit in this area that, these are the ones that are falling through the cracks. And these are the people that are going to benefit from the gaps from these departments. And, I want to speak to that because there are people that are experiencing homelessness, people that are grappling with addiction in this area. And alongside that, we have neighborhoods that are meticulously, continually a work in process to reproduce what it looked like 100 years ago. We also have the hospital there. And they're a partner in this. With Allegheny Health Network, this wouldn't be possible. So I'd like to thank them as well. But that whole community there on the north side is a place where, for a long time, we tried to do better. And there's other city employees, first responders, park rangers, PLI inspectors, individuals that would try to speak to these communities that are in transit and that are in need in this way. And they tried to fill the gap in getting them to services that are needed. And they really brought the idea that that we should know where they are, that they should stay in place. I was very heartened by the stories that I hear about people that work for the city that went above and beyond to change the perception of people that are in these situations. People that went to the homeless camps and did some cleaning, but then they also had these conversations of where they could try and connect services. And so it's this model, it's these efforts, these past efforts that, create what you would say a compassion fatigue. And so what we want to do is we want to incorporate this department in that way, where we're having outreach workers, individuals that have that encyclopedia ready at hand, and they're able to put people on the right track and to help fill the gaps in such critical areas. And so I'm happy to be a part of this. I'm happy that the North Side is going to be a partner in this, and it's really going to be driving Pittsburgh for future generations that will work here, that will live here, and that will they will really supply these needs that are in such high demand. So it's my pleasure to introduce someone, but I really want to, our next speaker, but I really want to speak to the praise that I have to give the mayor for, continuing on with the vision that Pittsburgh is a place for everyone, and that this is a path that, we must take so that we can fulfill, those words. So it's my pleasure to introduce Councilman Ricky Burgess, who will talk more about the other services that are going to be provided within this department.
Thank you, Councilman Wilson. Thank you, Mr. Mayor. I am humbled and grateful for your friendship and your partnership, along with Director Hisrich and Chief Schubert, and of course my legislative partner, Daniel Lavelle, in creating our shared vision for the Black community in Pittsburgh. Recently, the deaths of George Floyd, Breonna Taylor, Elijah McClain, and others sparked a nationwide movement demanding on the local level both police reform and massive investment in social programs that prevent poverty, crime, and homelessness. Here in Pittsburgh, we have witnessed the protest and have heard the activist demands. So today, as part of the Black Pittsburgh Matters agenda, we're excited to partner with the mayor to announce and to begin implementing the Health, Safety, and Violence Prevention Initiative. While the Office of Community Health and Safety focuses on the alternative responses we can have to public safety, the Office of Community Services and Violence Prevention will be focused on how we can be more restorative in our public safety practices. It will be charged with coordinating evidence-based public safety programs, community engagement, and racial reconciliation. It will also monitor and help implement the recently completed Pittsburgh Community Task Force for Police Reform recommendations. This office will coordinate these innovative public safety programs and facilitate ongoing partnerships with faith and community-based organizations. Within public safety, there now will be dedicated staff to ensure that programs can fully function. Public safety programming has been proven to reduce crime and violence in Pittsburgh. By expanding staffing, fully funding, and connecting these programs with social services, these results will be even greater. This will include the Group Violence Initiative, the Safer Together Community Engagement, and the Stop the Violence Initiative. We earlier last year declared as a city that institutional racism and its deadly effects is a public health crisis in Pittsburgh. We cannot police ourselves out of the problems we are having. We must start looking and investing in the underlying causes: homelessness, drug addiction, unemployment, and other things, which are overwhelmingly more prevalent in the Black community. This is our way of taking a public health approach to address the underlying issues. Historically, we put money into policing, prosecution, and incarceration. Now, we are prioritizing prevention, intervention, and reintegration. This initiative is the beginning of coordinating the city government's response and funding the solutions to the issues that plague Black Pittsburgh. Once again, we are saying clearly, loudly, and proudly, Black Pittsburgh matters. Black Pittsburgh matters means Black lives matter, protecting the health and safety of Black people. Black communities matter, rebuilding Black communities, and Black wealth matters, increasing employment and entrepreneurship. By working together, we can rebuild Black communities for Black people, by Black people, with our partners and allies. By working together, united in purpose, we can transform our city, strengthen it for all of its residents. By working together, this Health, Safety, and Violence Prevention Initiative, along with the previous announced avenues of hope, are the building blocks to increasing Black health, Black safety, and Black prosperity. By working together, we will make Pittsburgh a city for all by making it a city where Black Pittsburgh matters. Thank you very much. I want to now introduce my partner in council, my partner in the Black Pittsburgh Matters Initiative, Councilman Daniel Lavelle.
So I want to begin by thanking the mayor for his vision, his leadership, and his commitment to ensuring that the city of Pittsburgh does indeed become a city for all. Secondly, I want to thank my colleagues on city council. This past summer, in response to the national uproar and protest, council took some bold action, and we passed a series of police reform pieces of legislation. But two of those are critical for why we're here today. One of those was to create the Stop the Violence Investment Fund. The other piece was to actually divert funding from the Pittsburgh Police Department into that fund that could then support the social service work that we're here speaking about today. And if council hadn't taken that action, we would not be able to fund these new initiatives. I want to thank them for that. In addition, there are two specific things that I'm really excited about in addition to everything else that you've already heard. One is part of what we've heard this entire time from the community is help us help ourselves. We understand what is plaguing our communities, and we understand what it takes to bring our communities back and make them truly livable. But we need assistance. And part of this initiative will actually take mini grants that we'll be able to go into the north side, as Bobby was talking about, go into the east end, go into the Hill District, and partner with organizations that are on the ground doing the work, but need additional capacity to be able to take it to a greater scale. And so we'll be able now to fund those efforts. The second part that I'm really excited about is we have some gentlemen who are actually here with us today, part of the Group Balance Initiative, that have been working in our city for the past a little over 2 years now on what I will politely call a shoestring budget. Every day they have gotten up. In addition to their other full-time jobs, they've gone out and they've partnered with our police department, and they have absolutely made our city a safer place. And we can see it demonstrated in the numbers where our violence and our homicide have come down over the recent years. But now we're actually going to be able to use this funding to make our Group Balance Initiative full-time, all year round, all across our city. And that is truly monumental because we are now really putting our dollars where we said our priorities are. So I want to thank them for their work, but to get more into the details of what that'll actually look like and better explain the program and how they're doing such a phenomenal job, I want to bring up Chatara Murphy.
Good morning. Just to reintroduce myself, my name is Chatara Murphy. I'm the Assistant Director of our Public Safety Department. For the arm of the Community Services and Violence Prevention portion of this initiative, I will be managing those activities. And for the purpose of this press conference, I will elaborate on our work with GVI, as Councilman Lavelle so excitedly just talked about. So in short, for those who might need a quick refresher on what GVI is, Group Violence Intervention was designed to help us in our street outreach efforts to reduce homicides and violence that are gang-related in nature. It is a strategy where we partner with law enforcement, community members, social service providers, and we actually address the small percentage of those in the communities that are actually committing these violent crimes and causing these issues in our community, as opposed to punishing the community at large, which we've seen in the past where, the whole community suffers for the actions of a few bad actors. And when Director Hisrick came here, he, got to better understand what GVI was and how beneficial it would be for this city. And so he went after it full force. Without his unwavering support, we would not be able to do the work that we've done with GVI. Under the leadership of Chief Bickerstaff and Reverend Cornell Jones, with the support of Chief Schubert, we've been able to really increase our efforts in the community and make sure that this is really a community-driven initiative to reduce violence here in the city of Pittsburgh. We all know know that as government, we like to tell people what to do. We like to tell them how we're going to serve them. We like to tell them what their problems are, and we like to tell them what the solutions are. But with GVI, we want to make sure that we are very intentional about having the community tell us what the issues are and how we can best solve those issues, because they're the ones out there doing the work. We have 3 of our outreach workers here, as Councilman Lavelle had stated earlier, and if they don't mind, I'm going to just mention their names. We have Antoine Bailey, we have Vaughn Rivers, and we have Mike Logan here with us today. If I missed any other outreach workers, please raise your hand. Charge it to my head and not my heart. Okay. And so they do more, and I know this isn't part of the agenda, but I just wanted to add this in here really quickly. Our outreach workers are phenomenal. I have the opportunity to work very close with them. They do more than just, tackle street violence. They're helping our youth, making sure that they get to practices, being mentors to them, being able to help our seniors when they don't have access to food. If they come across people, in the community that are homeless or need other resources, they, with the little that they have, as Councilman Lavelle said, help our community members, taking money out of their own pockets, sacrificing time from their families and their friends and their loved ones, all for the city of Pittsburgh. And so this is a group of men and women that I appreciate, that we should all appreciate, and that we definitely need to work on how do we highlight and compensate them for the great work that they do for our city. So with that, I want to introduce our last speaker of the day, Mayor Peduto, and it's also his birthday today. So if everyone can take a moment and wish him happy birthday, that would be great.
Or not. First, before I say some remarks, I have to say we have an unsung hero with us today. Cameron from Parks got all of this, moved it from the north side, and was able to set it all up within 15 minutes. So thank you, my friend. Great job. Thank you to everybody that's on this portico today. We realize that we can do better. We realize that there is a strong demand throughout this country to reimagine policing. We realize that we're faced with multiple problems when it comes to our community. That there are those that struggle every day with homelessness, which is not a crime. That there are those that struggle every day trying to get by, that need help with the addiction they have, which is not a crime. And that there are those that are struggling with mental health issues, which is not a crime. And yet the way that we've dealt with it for decades has been to use police officers whose job is to enforce the criminal code. Today we stand here and we look at a different solution. What if we actually found the help and the people who are trained to deal with those issues and allowed them to be the ones to intervene? Yes, the officers will be there to make sure that they're safe and to make sure the community's safe. But once that officer leaves, there will be somebody left behind to deal with the root of the problem. Somebody trained in intervention, in being able to recognize that that's somebody's son, that's somebody's father, that's somebody's brother, and what they need is help. And then at the same time, running a second track, a track that looks into a community and says, how can we provide opportunity? When the only opportunity coming out of certain zip codes is that leads you on a pathway towards crime, then we have failed. We have got to be able to provide that opportunity for all. And we have to do it directly. Not through third parties that are working on the tangents, but actually working with the leaders in the neighborhoods of Pittsburgh, the people who live in Pittsburgh. the people that call Pittsburgh home, the ones who live in our black neighborhoods. And we have to invest directly into the efforts to help the children, the young adults, and those transitioning who were formerly incarcerated to get them on a path to success. Now, many people will say, well, that's the job of the schools, or that's the job of the county health department. But it's the job of all of us if we are true neighbors, if we are truly part of a community, if we truly want to believe that we are a city that says and does live by the statement, if it's not for all, it's not for us. We stand here today to recognize two distinct programs being pulled together as one with the goal of helping our brothers and sisters. When we talk about reimagining police, this is what we're talking about. We're talking about having our officers there in our neighborhoods where they're needed, where the calls are coming from, especially in our lower income neighborhoods, and recognize that critical need, can have new partners that are recognizing dealing directly with the core issues affecting people. It's a good day for Pittsburgh. It's a way for Pittsburgh to show leadership and to be able to show that we can reimagine policing in the 21st century. And it's a way for us to create a program that goes into action today, that follows upon the recommendations of our Police Reform Task Force, a group of community leaders assigned with the responsibility of finding ways to build a better Pittsburgh Bureau of Police. I want to thank City Council, and in particular, Council members Burgess and Lavelle, and the other black elected officials in the City of Pittsburgh who have been working all this year on finding proactive solutions to our problems. Not simply identifying where the problems are, but pulling together the community as one, and to be able to provide solutions to be able to address those problems. I want to thank Councilwoman Erica Strasburger, who's here with us as well, and the other members of council who didn't politicize this issue while this issue was being politicized all across the country. They worked on finding ways to help people, and they worked together, even when the opinions differed on how best to do it. And they deferred to the leadership from the black community when there were questions on what the best path forward was, so that the solution came from the community itself. And I want to thank my Chief of Staff, Dan Gilman, for pulling together all the pieces, for being able to make sure that everybody had a voice at the table, to making sure that all viewpoints were looked at and examined before we stood here today, and that there would be adequate resources to guarantee success. Like I said, we start today. This doesn't start with a new budget or a new year. These are two distinct actions that are being pulled together as one, and that will work in tandem in order to make Pittsburgh a better city for all. So with that, I want to thank everyone for being here. I want to give a shout out to all our TV meteorologists that told me it would be okay to be in the north side outside today. We all got that one wrong. But also I just want to thank every person on this portico. You are the solution. When Mr. Roger said, look for the helpers, you are the helpers. Thank you.